You're live, Ashima.
Good morning, everyone. Welcome to the live session with BabyChakra. I am your host, Ashima Madan. I worked as an associate scientist in nutraceutical company and now full-time Insta blogger from the name of Vedanshi Maya. And this morning, I am happy that Dr. Ash Sujit has joined the session to discuss a really important topic, baby development in womb. Unfortunately, Dr. Sneha is in emergency case, so she will not join us today. So before we begin, I want to give our audience a general insight into Baby Chakra, what our platform is all about. Baby Chakra is India's largest pregnancy and parenting platform. It is one-stop destination for pregnant women and expecting parents. So we try to connect parents with experts who bring valuable information and research-based information to all. On that note, I would like to kickstart our topic for today, and we are going to have an informative discussion today on baby development in womb. And we have an amazing lineup of guest speakers with us on board. Please welcome Dr. Ash Sujit. Sir, can you please introduce yourself? Dr. Sujit, can you
Sujit, I'm
please
a consultant
introduce yourself?
gynecologist, obstetrician from PD in the hospital. Not hear me? Is there a lag which is happening?
Dr. Sujit, thank you for joining us today and
Can
sparing some
you
time to bring lots of useful and helpful information to our viewers. So, experts believe that breast milk is the best nutritional choice for infants, but breastfeeding may not be possible for all women. Let us discuss the best way to indulge in the conversation with our expert in the panel today, who will address this topic in depth. So, we will begin with few questions. So, my first question for Dr. Ash Sujit is, what are the stages of fetal development?
just can you hear me
Yeah, it's audible, sir.
better?
Can you please give an insightful on the question? Like, what are the stages of fetal development?
Okay. So when we come to the development part, we have to understand that pregnancy has different variations. The pregnancy starts itself in one of the parts of the uterus, and the between the uterus and the ovary, there's a fallopian tube. That is where the sperm and the ovum meet, and that is where the initial beginning of the pregnancy happens. That is called the gestational side. The gestation happens, that's the first part, and that happens for the first 3 weeks. Once the pregnancy happens, there it keeps traveling from that part and it moves towards the uterus where the implantation happens. The implantation is one of the important procedures where the whatever the little baby, what happens is that's called the zygote. That gets attached to the uterus, and that is where the baby or the zygote starts imbibing the nourishment. That's the second part which happens in. And then that's the embryonal phase. So we got done with the gestational phase, we got done with the embryonal phase. That's from 3 weeks to the 8 weeks gestation. And eventually from 9 weeks onwards till delivery, what we as gynacs refer to as the most important part, that's the fetal phase. That is where the entire growth of the baby happens from the small, tiny, minuscule, the sperm and the ovum. Imagine you get a nice big 2.53 kg baby. That's the entire journey of the baby, which happens from the fallopian tube, uterus, and therein from.
Thank you so much, Dr. Ash. So, my second question is, like in third trimester, baby's development increases. So, what mother need to take care in this time?
Okay. Basically, there are different ways you have to take care of, right? From specifically from, well, let's go from the first trimester itself. Important things as doctors, we always advise patients for certain do's and don'ts. There are a lot of myths in the society. That is something I always try to address too. So initial things, yes, diet has to be kept properly. The diet has to be proper. You have to eat a balanced diet. That is very important. A balanced diet along with proper micronutrients is essential. Whenever you're trying for a pregnancy or whenever you think that the pregnancy is there, you move on to folic acid treatment that the doctor will advise you. After 12 weeks, you start with the iron calcium. That is important. Exercise is something which are very important, but exercise always do it under the guidance of your doctor. There are certain scenarios where we don't allow you to exercise or we tell you to bed rest, so that thing has to be kept into concern. The first 3 months are very difficult when you have to think about the diet because most of the mothers are vomiting or they are having morning sickness. At that time, I usually give my patients a leeway that yes, you can eat whatever you want, even a little bit of junk is allowed. But once you're done with the morning sickness part and once you're done with the first 3 months, diet is strictly something which we pay important attention to because the entire pregnancy, if a patient is in a normal BMI, you are allowed only a specific weight gain between somewhere around 11 to 18 kgs. That's something which is important. The routine walking exercise will continue. That helps in the process of normal delivery. Weight gain has to be monitored, and that is done by the doctors. Specific vaccinations which are required, that has to be taken into concern. These are little things which are becoming important, but yes, these are things where the mother has to be a little aware of. More than the mother, it's the parent, the father and the mother, who both have to be looking into these things.
Thank you so much, Dr. Ash, for such a great answer. So my another question is like when the scans are important to check for the baby development.
Okay. So there are multiple scans which we apply in the entire pregnancy. Firstly, we start with the first scan, which is at around 7 weeks of pregnancy. That's the important scan. That's either called a dating scan, a viability scan, where we check out the correct gestational age for the baby and we check for the viability, whether the baby is doing well. So we check for the heartbeat of the baby. That's done roughly at around 7 weeks. Then an important scan comes at around the end of 3 months, the 12-week scan, which is called the NT scan. That becomes very important in the current generation. You have to check whether the baby has any Down syndrome or any mental subnormality. That is something which always scares the parent. So at 12 weeks, we do something which is called the NT scan, where we check on the nuchal cord, the neck thickness, that's nuchal translucency or nuchal fold thickness. And along with that, we always send a blood test that's called a dual marker. In together, we get a value that is taken into consideration. At the same time, we check on the placenta, which starts forming at around 12 weeks. So that becomes important. At 20 weeks, the most important scan in the entire pregnancy, or if as gynecologists we say that you have to do only one scan, you do the 18 to 20-week scan. That's called the anomaly scan. In this, you almost see the entire baby and look at all the parts. That's a detailed scan where your radiologist or your sonologist will explain you, yeah, this is the head of the baby, these are the limbs of the baby, this is the stomach, this is the kidney, and everything. That's one important scan which has to be done and which the parent actually starts seeing the baby properly. At 24 weeks, we can do something which is called as a fetal 2D echo because the baby's heart and face are the last proper organs to develop. You can ask for a fetal 2D echo where you check the proper contractility of the heart. That's around 24 weeks. At 28 weeks, what we do is called a growth scan, where we check for the growth of the baby. As the name suggests, we check for the fluid around the baby, we check the placentization, we check the cervix, and all the other parameters where the blood flow to the baby is reaching properly. Similar thing is done again at 36 weeks, just prior to the delivery, where we are very sure that how the delivery is going to happen. If the baby is head down, then obviously we move in for a vaginal delivery. If the baby is transverse or if the baby has buttock presentation, then obviously the chance of normal delivery becomes less. We check for the cord, we check for the placenta, we check for the fluid. So these are basic things and basic sonography which are advised throughout the entire pregnancy, provide the pregnancy is moving at a normal pace.
Okay, thank you so much, Dr. Ash Sujit. Sir, the next question is: are the baby developed week by week?
So yes, babies develop week by week. The development happens at every week. There's certain change which happen in the baby. Like for example, if we take when we start calculating your pregnancy, we calculate from the last menstrual period. Your gynec will always ask for your LMP. But obviously, there's no pregnancy at that time. Your pregnancy happens 2 weeks after your LMP when you ovulate. So from that ovulation phase to the entire 9 months or the 40 weeks that we take as a calculation, there are a lot of changes which happen. The growth also happens accordingly. So, like we discussed, the fertilization happens in the tube. That's just one gamete and the other gamete meeting together and forming a proper chromosome. That's 46XX or XY. Then the small baby moves into the uterus and gets implanted. That's the zygote or the blastocyst state or the embryonal phase. And then every week, every day, the baby starts showing changes. First of all, the first thing which develops for the baby is the spinal cord or the nervous system. Then slowly you have the hands and the toes developing. At around 10 to 11 weeks, you have the genital organs developing. At around 12 weeks, you have the placenta, which is properly formed. At 20 weeks, like we already discussed, the entire baby is almost particularly formed. Between 3 months to 20 months, the 3 months to 20 weeks, that's 5 months, the entire baby is almost there. Then the growth starts in what we call as the growth of the baby or the hypertrophy of the organ started. At 24 weeks, the proper head thing is seen, the heart is seen. At 32 weeks, which becomes very important, the lungs start developing. That is something the pediatricians are particularly concerned about, the 32 weeks mark. The lungs start developing. At 36 weeks, yes, you're ready for the baby to be coming out to the outside world. Yes, we have survival rates after 24 weeks, but 36 is somewhere we are looking out for.
So it was really informative answer. Dr. Ash, can you please help us with our takeaway message from today's session?
Okay, the takeaway would be whenever you're starting planning for a pregnancy, meet a doctor for a preconceptional counseling. There are certain things which become important even before you plan a pregnancy. So that's something which you should always visit a gynec, and don't just visit a gynec when you're pregnant. Second thing is whenever you're meeting a gynec, keep a proper log of all the important documentation of the records, including your lab reports and your sonography. Ask your doctors questions. Every pregnancy is different. Even for a mother, the first pregnancy and the second pregnancy will be different. So there are different changes which happen. Be free to be inquisitive, read about things, and ask your doctor and speak about different things and manage it. Proper follow orders. If you're advised to take a particular diet, follow that. If you're advised to take blood pressure at particular intervals, you do that and continue your medication. The folic acid, iron, calcium, that becomes very important. Exercise is must. Diet is must. Eventually, the goal is to attain a healthy mother and a healthy baby, not a vaginal delivery, not a cesarean, not any other outcomes. But then, yes, it should be a healthy baby coming out from a healthy mother. That's the takeaway, I guess, which everyone should from the talk.
So it was a wonderful, interactive, and insightful session, sir, where we learned the body and the baby development in the womb. And thanks a lot for joining us today. The tips you have provided are extremely helpful, and I'm sure all the moms and dads will find them useful too. With that, we come to end of our live session today. Thanks to our wonderful viewers who joining us today, and thank you, Dr. Ash, for sharing so many helpful pointers with us. Guys,
Thank you.
do keep
Pleasure.
following us on Baby Chakra and stay tuned for more helpful parenting videos and tips. Thank you so much, guys.
Thank you. Bye bye.